Finally on our show, it's my pleasure to welcome Stephen Reynolds, President Emeritus of Baptist Memorial Healthcare. Mr. Reynolds spent his entire 43-year career with Baptist Memorial Healthcare, including 20 years as its president and CEO. In honor of his years of service and his contributions to this facility, the Baptist Trinity Hospice House was renamed the Baptist Reynolds Hospice House last year. Mr. Reynolds, welcome to Health Matters.
Thank you, Mark. It's really a privilege to be here.
Well, you have been so important to Baptist, and this facility that we're filming today's show from is just a testament to all the hard work and everything that you've done at Baptist. Why was the need seen for this place?
Well, the residential hospice house was really born out of an idea that developed when we had home care hospice, sponsored by the Baptist Trinity home care team. And then we moved from the home to develop an acute care hospice unit at Baptist Memphis, the first in our community. So the idea of a residential hospice house was a natural extension. We had a group of professionals who traveled all across the nation to look at models, successful models of hospice care in a residential setting. And we were fortunate to have the full support of the Baptist Foundation and families like the Kimmons-Wilson family who helped raise the funds to create such a beautiful place as this.
Now, Steve, I know you have a personal connection to a hospice facility. Share that story with us.
Well, our experience with hospice care really began with my dad. And my dad became ill. He needed hospice care. And at the time, the hospice care that was available through the Baptist Trinity Home Care was through the home setting. My dad experienced the wonderful angels of Baptist Trinity Home Care as they came and ministered to him and helped him really step into heaven with grace and dignity. That was the beginning. Then my mother had for many years served as a hospice volunteer, and she helped us understand the beauty and the importance of hospice care. A few years later, my mom, she became ill and she needed hospice care. And so we had to make the decision, what do we do? And fortunately, that dream from a few years ago had become reality through this hospice house. I will never forget the day, Mark, when we were standing at the door of this hospice house and the ambulance came up. The doors open and there's my mother, and she says, "Finally, I am here," with a big smile on her face. It was a special time in our life and a special time in her life.
You know, I was thinking about this, about what a wonderful place this is, and what a wonderful venue to go to heaven from. Many people that have come to this place, this was their door to heaven. And my personal experience with the patients I've had here and the staff that you have here has just been the perfect setting. I mean, it just could not be any better.
Well, it is a special place. Special people work here. The team at the Baptist Trinity Hospice House is the very best. They're dedicated to their work. They love their work. They love their patients, and they love their patients' families. Now, I remember when my mom came here, she thought she was the caregiver. And as a matter of fact, she was. She ministered to the needs of other patients and their families. She wanted to tell all of her friends, all of her family members, her ministers, and others, anybody who would listen, about the importance of hospice care and what it could mean to their lives. And it was a wonderful experience. The staff here at the Baptist Trinity Hospice House, they loved my mom. They cared for my mom. They prayed with her, and they prayed for her, and they comforted our family. It was the most special experience, and she was a happy person. And this was a very happy time, and I will always be grateful to the team here at the Hospice House, the board at Baptist Memorial Healthcare, all those people who gave their funds to create such a place as this, because it helped my mom enter heaven with great happiness, great joy, and with grace and dignity.
What a great word. What do you see about the future What about taking this to the next level? What do you see that we could do?
Well, that is a really good question as to what is the next step for hospice care. And I think one of the best things we can do is ask the patients and ask the family members, what could we do to enrich your life? What could we do differently? And when we made the decision to develop this place, the feedback that we got from patients was, I would like to be in a place like my home. And a lot of families, as you know, Mark, don't have a home that's equipped for round-the-clock care. And they were looking for a place other than a hospital where they could experience this chapter in their lives. So where do we go from here? I think what we can do at Baptist Memorial Healthcare is to share this idea with other people all across the country, just like people shared it with us. Share with them our successes and what the patients and families are telling us, and to extend this service wherever. Don't know what all the answers are, but if we listen to our patients and their families, I'm sure we will find them.
Well, thank you so much for being here today. I tell you folks, this is just a wonderful, special place here at the Hospice House, and we really have a lot to thank Mr. Reynolds for. So stay tuned to Health Matters. We'll be right back.